nearly all of those patients are having decreased production of thyroid hormones, because the signal that comes from the brain in order to stimulate the thyroid gland to produce thyroid hormones, this signal is decreased as the blood flow is not normal to the range of so-called ischemic penumbra, which is insufficient to cause irreversible damage. If the blood flow is at that level, you will have decreased the levels of the hormone that stimulates the thyroid gland to produce its own hormones. Mm-hmm. That is a condition called hypothyroidism. And if you have decreased production of thyroid hormones, the respiratory centers will not respond to Apnoe-Test. That's the second reason why the respiratory centers cannot respond to Apnoe-Test. So those patients are not receiving proper, updated, timely treatment. Patients having hypothyroidism will have increased brain edema. I mean, the brain will increase in size and will cause further increase in intracranial pressure. That means that the blood vessels will be further compressed by the presence of hypothyroidism. And if you don't treat hypothyroidism in these patients, you cannot have the regression of brain edema. You cannot save those lives. Another issue is that exactly for the same reason, because you have partially decreased blood pressure and blood flow to the brain, you may also have decreased production of the hormone that stimulates another gland that is called adrenal gland. And without adrenal hormones, you will have low blood pressure. And the patient will die if you don't replace those hormones. So you have two lethal conditions, which is hypothyroidism and adrenal failure in patients who are in deep coma, for example, as a consequence of severe head trauma. Two conditions that would be lethal if they were isolated and not treated. And they are associated in the same person. So you have two lethal conditions that are left untreated in patients with severe head trauma. And those patients, instead of receiving proper treatment, these patients are submitted to Apnoe-Test sometimes once or twice to make sure that they are brain dead. Yes. And by doing this, they are inducing death in patients that could be recovered to normal life. That's very important. We are not talking about recovering to a vegetative state.
Yes,
we are talking about recovering to normal life.
To a normal life.
Yes.
But why don't they change the criteria of brain death when they all know that from 2000 to now? They know that, but why don't they change it?
Yes, we have been asking that question in medical websites, like in the British Medical Journal website. And the answers that we got simply surprises us.
They don't know.
No, they say that they cannot avoid doing Apnoe-Test, because if the patients breathes in the operating room, that would be a disaster for the transplant surgeon, because it would be crystal clear that that patient was alive by the time when his organs were
But if they give them...
taken away.
Yeah, but if they give them...
The reason why they are performing the Apnoe-Test is because in no culture all over the world, a patient who is able to breathe can be considered dead. So they say that they have to test those patients for their ability to breathe, because taking them to the operating room.
What is the conclusion with the Apnoe-Test? What shall doctors do now?
Well, the worst thing about that is that most doctors don't know about what we are discussing here. So that's why it's so important for you to take these discussions to the general public, because then medical doctors will have to be updated about the physiological issues related to coma. They would understand that by inducing Apnoe-Test for up to 10 minutes, they are killing patients in order to make sure that they are dead. And they don't know that, because
legal.
they are taught that this is the legal procedure to be done.
Yes.
We have told those things to those who support the transplantation system, and we got no answers. We simply got no answers. Once, in an international meeting, a neurologist told me that there is no problem about performing Apnoe-Test, because he said he knew in advance that the patient was already dead. But this is nonsense, because the test is a diagnostic test. How can he have the diagnosis in advance if he is about to perform the test to diagnose brain death? But that's the only answer that I got. It induces that. Induces that. I repeat what I said before. By performing the Apnoe-Test, we are killing patients in order to make sure that they are dead. The Apnoe-Test is performed without the consent of the family. And we know that some of those patients, this is being published in the medical literature, we know that some of those patients may have cardiac arrest irreversible cardiac arrest during the test. Because the test is so aggressive to them, to the heart function. But when you do that test on a patient for the diagnosis of brain death, you are not anticipating any benefit to that patient. He had only the risks of the tests. He will not have any benefit from that test. And that's why all those diagnostic tests, including especially the Apnoe-Tests, are unethical. There is no possible benefit for the patient. And he is being denied proper, updated, timely treatment. If you want to perform a test on your relative, which is defenseless because he is in coma, so you have to give permission to that. And if you have to give permission to that, you have to be informed about the risks and the benefits. And then the doctor will have to tell you honestly that there is no benefit and there is a lot of risks. And you have to sign it that you accept that. If you do that, if you are properly informed, you would not sign, because there is no benefit, and you now know that your relative is not receiving proper treatment.